Welcome back. It's still Morning Rush on Metro Television. We are live on DSTV channel 277, live on Facebook, and YouTube is Metro TV Ghana. Don't forget to follow us on Instagram, Metro TV_GH. So Dr. SHERIF Okyeere is here, who is an alternative medical practitioner with Army Scientific and Alternative Medical Hospital. And this morning we are talking about uterine fibroids. Yes, uterine fibroids. And it has everything to do with women. Yes. So it develops in a uterus. Exactly. And so let's say with statistics, out of 5 women, yes, how many will be affected? How many will not be affected? So that we get to understand how severe it is. So
when you look at the statistics, at least between 20 to 80% of women will have fibroid from puberty up to age 50. So some will probably know they have it, some will go unnoticed. So it tells you that a lot of women, one way or the other, or throughout their lifetime, will have issues when it comes to fibroids.
What about people who are now experiencing their puberty at an early age?
Yes, so when you look at some of the risk factors, people who have menarche, that is the first time menses, they have high tendency of having issues with fibroids. So it's one of the risk factors for developing uterine fibroids.
What exactly is it?
So uterine fibroids, as you mentioned, is a growth, within the uterus, you understand. So it is a non-cancerous or a benign tumor that grows within the uterine, cavity, and it can go unnoticed. That is, it can be asymptomatic. So some women will have fibroid.
It's a silent killer.
Yes, it's like that. So when you look at the image that we have on the screen, you could see different positions within the uterus that we have some growth or some tumor growing in there. Yeah. And it shows the different types of fibroids that can, affect women. Depending on the site of the nodule or the growth, it has its own implications on women. So you look at the one at the top, we call it fundal, uterus. Usually it grows, on top of the uterus is actually like that. So when it grows on top like that, we call it a fundal uterus. We have intramural uterus that grows within the muscles, more like the center of the uterine muscles in there. We have the subserosal. Usually it grows outside of the uterus. We have submucosal, which will also grow towards the endometrial cavity. And usually with this type of nodule or these type of fibroids, that's when it starts giving women troubles. You understand? So it has a tendency of affecting your fertility, has a tendency of affecting even how your menses, comes. Yeah. Some people will go through severe pain during that time of the month. Some people will bleed heavily, during that time of the month. Some people go through, so many uncomfortable situations when it comes to these type of fibroids. You could see some women experiencing miscarriages. They can get pregnant, but after 2-3 months, they lose the pregnancy. This type of fibroids has a tendency of causing these kind of problems to women. We have other ones like the pedunculated fibroid, which grows like a stalk, like a leaf stalk. So it has a stalk like that, and so there are different types of fibroids that that can affect women. And usually it's the effects that some of these conditions, especially fibroid, comes with, also is dependent on the size. You understand? So as I mentioned earlier, some can go unnoticed. So on ultrasound, some can be as small as
it can be invisible.
Yes, 0.2 centimeters. Some can be 1, 2, 3. Usually, when it goes beyond 4, say 5 centimeters, 6, some can be very big. Some can be very big.
And we will presume you are pregnant.
Yes.
Okay.
So you see some women, the abdomen will start getting bigger.
Yeah.
Presumably, when you're a woman and your abdomen starts getting bigger, one of the things that comes to mind is probably you're pregnant.
Yeah.
But no, some of the fibroid can be very big, even more than how some pregnant women looks. You understand?
True.
So it can
really be
actually
big. Yeah.
get very big in some situations.
You mentioned different types of fibroids. Does different activities cause the different types, or same activities cause the types? It doesn't mean there are different activities.
No. Okay. Same activities cause
the different types.
And the different types is dependent on the site of location.
Okay.
The site of the location of the fibroid within the uterus.
Yeah. Is it a blood clot that causes fibroid?
Yeah, so that is one of the myths, about, uterine fibroids. A lot of times you hear some of these things that, there's blood clots that is lodging somewhere that is giving you fibroid.
Yes.
Some people will even say that when you're not having your menses,
yes.
It will
accumulate.
Exactly, that is the right way. It will accumulate and give you fibroid. But no, there's nothing like that. Fibroid doesn't happen as a result of blood clot. Neither will it happen as a result of you not having your menses.
Okay.
No, it is totally false.
Okay.
Fibroid actually comes about when the uterine tissues start growing abnormally. So when you look at the image that was shown on the screen, you could see that the growth is within the uterine tissues.
Yeah.
The uterine tissues that is growing abnormally.
Yeah. Oh, yes. I think that is within.
It's
not something that came about.
No. So the growth is actually emanating from the uterine tissues, the uterine cells, the uterine muscles that is supposed to.
The lines there, you can see them becoming bigger.
You understand? So it has nothing to do with blood clots or your menstruation not coming.
Okay. But then I'm tempted to also ask, what is making it grow bigger? Because if I'm there and I haven't done anything, why should it go bigger? Is it that there's an activity I have done or something is causing it? Okay, so
when you look at causes of uterine fibroids, usually it is being linked with certain hormones in the body. Estrogen and progesterone, that is for women. So at some points when there's a lot of imbalances within some of these, hormones, it could trigger the growth, abnormal growth of these uterine tissues, which could lead to, uterine fibroids. So the main cause has to do with estrogen and progesterone imbalances within the system. It has a tendency of causing, uterine fibroids. But then apart from that, there are other risks. You understand? There are other risk factors that can predispose someone in getting uterine fibroids. Unused uterus.
Unused uterus?
Yes.
Which one is the unused one?
So the uterus has only one purpose. It has only one purpose for women. That is to carry babies. So if you are not using the uterus for its purpose,
to carry baby,
if it's so, maybe 35, 40, you've never given birth. You understand? That is what I mean. So if you are not using it for that purpose, it can, give room,
could develop.
It could give room for uterine fibroids to grow. And then also family history. So if there's a history of, uterine fibroids. So your mom, your grandmom, your sisters, if there's that history within the family, it could also predispose someone in getting some of these conditions. And then also the black race, you know, some of the research has shown that the black race develop uterine fibroids higher than all other races that we have.
Oh, okay.
So the black race also have a tendency of developing.
Why should my race?
Yes, uterine fibroids.
Put me at risk.
Yes, and then also even being obese. You know, when you are bigger than your BMI, your obesity, it also has a tendency
of developing,
of causing some of these conditions.
It's a lot, but Doc, it's non-cancerous.
Yes, it's yes. So it is a benign tumor.
Good.
Uterine fibroids are benign tumors.
Good.
They are non-cancerous.
That has been established.
Yes,
fine.
it is non-cancerous.
But how dangerous are they?
It can be very disturbing, you know, condition because of the fact that some fibroids can actually cause infertility issues for some women.
Okay.
You understand? So some women, because of the size, especially with the submucosal uterine fibroids, they grow inside the uterine cavity. So if you are trying to conceive, or even when you get pregnant, and the uterine fibroid is occupying majority of this space that is supposed to be for the babies, the fetus, it could cause restrictive growth of these fetuses. You understand? It could cause miscarriages even when you get pregnant. It could cause what we call placenta approachio. That is when the placenta detach itself from the uterine walls, which is not supposed to be so until the woman is giving birth. You understand? So there are a lot of complications that can come as a result of that. You know, it can give you, you know, uncomfortable
abdominal
looks. Abdominal,
pains,
you know, distended abdomen, as if you're pregnant, the pain that you go through during your menstrual cycle. Some people, they can even menstruate 2-3 times within 1 month. Some even experience bleeding in between periods.
Since you are touching on the symptoms, let's touch on that more.
Yes.
Aside those, but don't forget that some of the women, we have fat in our stomach. We have eaten late at night, so we have developed bigger belly, abdominal fat and stuff. So let's not confuse it with that.
So that is why a doctor would have to actually do a pelvic examination to actually distinguish between a uterine fibroid from abdominal fat. Okay. You understand? So not all distended abdomen are as a result of
establish
uterine fibroids. They have a different, you know, characteristics altogether. You understand? So please, not all abdominal fat or distended abdomen are as a result of uterine fibroids.
Thank you very much.
But then uterine fibroid can also give you those kind of, you know, presentations. Heavy menstrual bleeding, which will automatically cause anemia. So some women, every time they are having issues with their HB levels because they bleed a lot, so they go through anemia at the end of every month. You understand? Some will have their menstrual cycle being irregular, having twice menstrual, you know, periods within 1 month. Bleeding in between periods, you know, very severe menstrual pains and all that. Some even at a point can even experience pains during sexual intercourse and all that. Some will have urgency of urination. You know, there's frequency of urination, there's urgency. Some can even experience what we call constipation as a result of uterine fibroid. Yes.
Constipation?
Yes. It can actually cause that. So it gives you a lot of, you know, uncomfortable situations when it comes to, you know, uterine fibroid. So it is one condition that we need to pay attention to, and also we also have to be very careful about some of these misconceptions about surrounding uterine fibroids. The mere fact that, you know, people go about saying all sort of things about uterine fibroids. It is, yes, it happens to a lot of women, but it is something that, you know, with proper measures and, you know, proper, you know, diagnosis and all those things, proper treatment, it can be taken care of. Yeah.
Talking about diagnostics and everything, let's talk about the treatment.
Yes.
How? Because the only solution that is like privy to everybody is surgery.
Yes.
You have to take it out.
So yes, so surgery is one of the measures for uterine fibroids. But apart from that, there are other treatment modalities that can be done, especially when the sizes are not that significant. You understand? So when you come to Amen Scientific Herbal and Alternative Medical Hospital, for example, and yes, to talk about some of the misconceptions. So when you go to any place, any hospital, any facility, and the person who is taking care of you goes by, I will nanny your fibroid. Is it melt?
As in shrink it or melt it?
No, there's a word that they use. Or say men nanny or fibroid. When you hear someone saying that word to you, you need to run away. It only means that the person doesn't know what he or she is about when it comes to fibroid, because when it comes to fibroid treatment, the only way, apart from surgery, to treat fibroid is to give medication that will shrink the fibroid nodule. So we don't nanny fibroid. Okay. So when you get to any facility and the person goes by men nanny fibroid, you need to run.
But how are you going to nanny the fibroid?
Yes, that is why I'm saying that anybody who goes by saying that doesn't know what he or she is about. The only treatment, so when you come to Amen Scientific Herbal and Alternative Medical Hospital, for example, we need to identify what is causing the fibroid. Is it the hormones? Is it the rays? So we need to give you medications to help shrink, because these tissues that are growing, that are getting bigger, are your normal uterine tissues that is supposed to be there. You understand? So if they are getting bigger, you only give medication to help reduce, first and foremost, reduce the growth of these tissues, of these fibroids. Secondly, to help shrink the fibroid, these nodules that was shown on the screen, so that the tissues can get back to its usual form before these fibroids started. You understand? So, and that is what has helped Amen Scientific Herbal and Alternative Medical Hospital when it comes to treatment for conditions like this. Fibroid. We have been very, very successful because we know what it takes. We know how the things that needs to be given to help some of these, you know, situations to resolve, either than going about saying things that we don't know. So if you're watching us this morning, especially with people who have fibroid issues and their fibroid sizes are not too significant, from 5 centimeters downwards, just come to Amen Scientific Herbal and Alternative Medical Hospital, and we have proper treatment for you to be able to get rid of these fibroid issues that you've been battling with for so long.
But Doc, July is Fibroid Awareness Month. And a month that is very, very important for women to understand and also know the treatment. How often do women come to your center to say that I'm coming to check, not that I have, but I'm coming for treatment, but I'm coming to check? How often do women just walk into Amen Scientific?
I think maybe it will be 1 in hundreds. You understand? Because usually for a typical Ghanaian woman, they will only come to the hospital when it comes to some of these things, especially when they are married, they're trying to conceive and it's not coming. That is the only time they will come. Or in some situations, maybe they're having issues with their menstrual cycle, challenges and all those things. If not, you will not usually see someone coming to the hospital like to come and check, probably come and do an ultrasound scan to see how the uterus is, how things are going on within the uterus. So, and just as I mentioned, some can go unnoticed. Some of the fibroid might not give you any sign or any symptom. Before you realize it has grown beyond boundaries. And that is when it starts giving you a lot of problems. So we are encouraging our women, you understand, because we are even still doing the free health screening.
Yeah.
So you have to come and do these ultrasound. It's free.
Yeah.
Yes. Just come and do this free screening. Come and get your uterus scanned so that we see what is going on there. You understand?
Yeah.
So it is advantage for all of us watching us this morning, especially our women.
Yeah.
And today happens to be holiday. We are still working. So
okay. Then that's good.
Yes. Just walk into Amen Scientific Herbal and Alternative Medical Hospital branches near you.
Yeah.
We are all over Ghana.
Yeah.
We are all over Ghana. So you just walk into any of our facilities and get your uterus checked, scanned, for us to see what is going on.
I want anyone that's watching and is interested in going to check, understand how the process. I don't know if how I checked mine is how everyone on is going to be like. I went to the hospital to check if I had fibroid or any other abdominal problem. Now, you are asked to lie down. They put the jelly substance under your abdomen.
Your lower abdomen.
Your lower abdomen. And then what's the name of the machine?
The probe, yes. So that is the ultrasound scan.
Okay.
So they will put the probe and then the probe will actually scan for us to see the uterus, how things are going, your ovaries and your tubes and all those. So the ultrasound has a tendency of doing all those things.
Yeah.
So you know, with the scan, some will use the curve or the linear probe. Some can also use we have it transvaginal. Some can even go through there to actually
really see it clearly.
Yes. So especially when the top one is not giving you a clear image.
So that's what I wanted my question to come from. That will the normal one where you just have to wave the machine on your abdomen give you the exact results, or you have to go an extra mile where they have to insert to check through?
So there's another probe that can also go in there to also scan. And then in even some situations, a CT or MRI can also be done. You understand? So they are advanced tests, especially when you are not too clear about what you are seeing on an ultrasound scan. You can do a CT abdomen or MRI abdomen to actually have a clear view of what is going on there.
You know, the numbers are on your screen. Like Dr. Sherif said, it's free. Amen is showing their gratitude to Ghanaians for over the years, making them #1 when it comes to alternative medicine in Ghana. And so if you are home and you are watching us, the numbers are on your screen. Pick a phone, call, check which center is closer to you, and just walk in and check yourself. Just check yourself. Please kindly do that because it's very, very important. But then, Doc, take us through the centers in Ghana. Let's start from the top.
Yes, so from the top, we are in Bolga, we are in Wa, we are in Tamale, we are in Sunyane, we are in Atebubu, we are in Kwame Danso, we are in Kumasi, Achumatechiman, we are in Takrade, Apramdo, we are at Inche, 1+1 sport, Nkoko, Suta Abanasi, whole housing down, around Secret Heart Senior High School, Hohoi at Adabasi Rural Bank, Baby any
all 16 regions.
Yes, we are all over. We are all over. We recently started in Kwanta branch, in Kwanta at OT region. So those around those places can also go there. In Accra, we have 2 branches here. One at Domain, Sned Flats, close to the rail line, and one at Lashibi Klagon, close to the Ashamai Underbridge. So just take the numbers on the screen and call Amen Scientific Herbal and Alternative Medical Hospital. Anything concerning your health, just call us.
Even if you didn't hear your location.
Yes.
I think when you pick the number and you
yes,
call
yes,
and you tell them where you are.
Yes.
They
Off
can actually
probably
help you.
I skipped some of the centers. So yes, just call the numbers on your screen: 0244-227-192 and 0207-229-505, and the last one is 0245-275-254. Call any of these numbers and you reach out to Amen Scientific Herbal and Alternative Medical Hospital.
Doc, thank you very much for the conversation this morning. We really, really appreciate that a lot. So we've been speaking to Dr. SHERIF Okyeere, who is an alternative medical practitioner with Amen Scientific and Alternative Medical Hospital, and they are saying it's free. They are showing their appreciation to Ghanaians for supporting them over the years, so they are giving back to Ghanaians. And today being a holiday, just pick your phone, call any of the lines you see on the screen, and then get to talk to somebody. Tell us your location, and then just, go and check yourself. It's very, very important. Yeah, Doc, thank you very much for coming. Really, really appreciate it. You're looking dapper and all nice like that.
Thank you so much.
Yeah.
We are all enjoying.
67 years.
67,
it's not easy.
yeah.
67 years of freedom. It's not easy. It's not easy.
Yes.
Thank you very much, Doc.